Have you ever sat in a doctor's office and felt like the decision was already made for you? The doctor speaks calmly, the nurse nods, and suddenly the word surgery enters the room. Many people over 70 have experienced this moment. It can feel confusing, it can feel rushed, and sometimes it can feel like there is no real choice. But the truth is something every older adult deserves to hear. After the age of 70, not every surgery that is offered is automatically the best path forward. It heals differently now. It responds differently to anesthesia. And sometimes the wiser decision is not speed, but careful thought. As a doctor who has spent many years speaking with older patients, I have seen how important it is to pause and ask the right questions. Surgery can save lives. It can relieve pain. It can restore movement. But in certain situations, especially later in life, the risks may quietly outweigh the benefits. Today I want to gently walk you through 6 surgeries that seniors should approach with caution. This does not mean they are always wrong. In some cases, they are necessary. But understanding when to slow down and think carefully can protect your independence, your clarity of mind, and your quality of life. Surgery number 1, elective spinal fusion for chronic back pain. Back pain is one of the most common problems people face after the age of 60 or 70. The spine has worked hard for many years. Discs become thinner. Joints become stiffer. These changes are a natural part of aging. But when someone gets a scan of their spine, the images can look alarming. Words like degeneration, narrowing, or instability may appear in the report. When these words are read aloud in a doctor's office, it can sound like something dangerous is happening inside your back. This is often when spinal fusion surgery is suggested. The idea seems simple. If 2 bones in the spine are causing pain, they can be fused together to create stability. But spinal fusion is a major operation. It involves anesthesia, surgical hardware, and a long recovery period. After the age of 70, the body may take much longer to heal from such a procedure. Robert had lived with back discomfort for nearly 10 years. It was frustrating, but he was still able to walk around his neighborhood and do small tasks in his garden. One day, an imaging test showed wear and tear in his lower spine. Surgery was recommended quickly. Robert believed it was the only way to fix the problem. His movement became more limited during the long healing process. For the first time in his life, he needed help from others to do everyday tasks. Stories like Robert's do not mean spinal fusion should never be done. There are cases where nerves are severely compressed or the spine is dangerously unstable. In those situations, surgery may truly be necessary. But for many older adults whose pain is manageable, other options can sometimes provide relief. Gentle physical therapy, strengthening the muscles that support the spine, improving posture, losing a small amount of weight. These steps can often reduce pressure on the back without exposing the body to major surgical stress. The most important lesson here is not fear. It is patience. If surgery is suggested, ask what the goal truly is. Ask how many people your age experience meaningful improvement. And ask whether conservative treatment has been fully explored first. Now let us move to surgery. Surgery number 2, carotid artery, surgery for mild blockage. Many people discover carotid artery narrowing during routine medical testing. The carotid arteries run along the sides of the neck and supply blood to the brain. When doctors find narrowing in these arteries, the word stroke often enters the conversation very quickly. And that word can create immediate fear. No one wants to imagine losing speech, balance, or independence because of a stroke. So when surgery is offered as a way to prevent that possibility, it can feel like the obvious choice. But for seniors over 70, the situation is not always so simple. Carotid artery surgery is designed to remove plaque from the artery or place a stent to keep it open. While these procedures can be helpful in certain cases, they also carry their own risks. Stroke can occur during the procedure itself. Bleeding or complications from anesthesia may also happen. I remember speaking with a 75-year-old woman named Linda. During a routine checkup, a scan showed moderate narrowing in one of her carotid arteries. Surgery was recommended almost immediately. but Linda decided to seek a second opinion. The second doctor explained that because she had no symptoms, careful medical management might be a safer path for now. With medication, healthy habits, and regular monitoring, her stroke risk could be controlled without immediate surgery. Time to think. And sometimes time is the most powerful medicine of all. For older adults with mild blockage and no warning signs, the lesson here is simple. Fear should never rush you into a decision about your body. Your brain is one of the most precious parts of your body. Protecting it sometimes means slowing down and asking calm, thoughtful questions. Now let us continue with surgery number 3. Surgery number 3, knee replacement for mild osteoarthritis. Many people over the age of 70 live with knee pain. It often begins slowly. Perhaps the knee feels stiff in the morning. Maybe it aches after a long walk or when climbing stairs. These small discomforts can gradually change daily life. Doctors often take an X-ray of the knee. When they look at the image, they may see thinning cartilage or narrowing of the joint space. To the eye of a surgeon, the joint can appear worn and damaged. This is when knee replacement surgery is often suggested. And it is important to say that knee replacement can be very helpful for many people. Some patients regain mobility and freedom after the operation. But timing matters greatly, especially after the age of 70. Knee replacement is not a small procedure. Muscles and tissues around the joint are cut during surgery. Then comes a long period of rehabilitation. Recovery demands strength, balance, and determination. Physical therapy can last for months. For a younger patient, this process may be manageable. But for someone in their late 70s or 80s, the recovery journey can be much harder. It can be life-changing for people whose pain is severe and constant. But if the pain is still manageable, strengthening the body around the joint can sometimes protect the surgery number 4, coronary stent placement for stable heart disease. When people hear the word heart, fear often rises immediately. Heart problems feel urgent. They feel life-threatening. Coronary stents are small metal tubes placed inside heart arteries to keep them open. During a heart attack, these stents can save lives by restoring blood flow quickly. But not every blocked artery requires immediate stenting. Some seniors are diagnosed with stable heart disease. This means the arteries show narrowing, but the person may have few symptoms or only mild discomfort during heavy activity. Modern medicine offers many ways to manage this condition. Careful management can sometimes protect the heart just as well. Surgery number 5. Prostate surgery for mild urinary symptoms. Many men over 70 experience changes in urination. Waking up during the night becomes more common. These symptoms often come from a naturally enlarged prostate. This condition is very common and usually develops slowly over time. Because the symptoms can disturb sleep, surgery is sometimes offered as a quick solution. Procedures are designed to remove or reduce prostate tissue so urine can flow more easily. But after the age of 70, these procedures can carry risks that are not always fully explained. Anesthesia can sometimes lead to confusion in older adults. Balance may be affected for a short time after surgery. Some men experience urinary leakage or other side effects that were not expected. Surgery number 6. Aggressive cancer surgery for slow-growing tumors. Few words create more fear than the word cancer. When people hear it, the instinct is to remove it immediately. But after the age of 70, not every cancer diagnosis requires aggressive surgery. Some tumors grow very slowly. Certain prostate cancers, small kidney tumors, and some thyroid nodules may remain stable for many years. Major cancer surgery can place enormous stress on the body. Hospital stays and recovery periods can sometimes affect memory, strength, and independence. I once spoke with an 84-year-old man named Harold. A small prostate tumor was discovered during routine testing. Surgery was recommended quickly. This story reminds us of something important. Growing older gives us the wisdom to think carefully before making major decisions. Your body has carried you through many seasons of life. You have the right to ask questions. You have the right to pause. And you have the right to choose the path that protects both your health and your peace of mind. If this message helped you think differently about your health, write wise choices below and tell us where you are watching from. And if you appreciate calm guidance like this, follow Elderly Roots for more caring advice to help you live safely, independently, and with dignity in every stage of life.